Thank you so much for having me today to speak on Black geriatric mental health. I am Dr. C. Freeman, and I have no financial disclosures. I recall early in my career trying to console an elderly African American woman who was nearly in tears. She had just visited the medical doctor and felt as if her concerns had been dismissed and as if she was an actual annoyance. I was unaware that health disparities in medicine occurred, but I was aware that there was an exponential growth that was projected in older adults and that there would be a need for someone to be specifically trained to understand them within a cultural context. Therefore, I became a geriatric psychiatrist. Therefore, I am very happy today to share with you the experiences of my patients and their families, many of whom are African American older adults, and the challenges that they have had with the COVID-19 pandemic. Since the beginning of the U.S. Census, the African American population has been growing continuously. It is comprised of mixed ethnic and cultural heritages, and it exists in multiple living settings. The growth rate of African Americans 65 and older is outpacing the growth rate of African Americans in any other age group, even though death rates in African Americans 65 to 84 are higher than among any other racial or ethnic group. In those over the age of 85, the death rate is lower. Some of you may be asking, if this is about mental health, why are we talking about death rates? Well, physical health has an impact on mental health and vice versa. For African Americans, health disparities exist and are higher in both physical as well as mental conditions. Compared to whites, African Americans experience more heart disease, stroke, cancer, asthma, pneumonia, diabetes, HIV/AIDS, and homicide. Except for HIV/AIDS and homicide, all these conditions are common in older adults. All these conditions increase the risk of becoming seriously ill and dying from COVID-19. We see similar disparities when African Americans are 20% more likely to experience serious mental health problems than the general population. Mental health and well-being are as important in older age as at any other time in life. Over 20% of adults age 60 and over suffer from mental and neurological disorders at some point in time. Most common disorders in this age group are depression and dementia. Depression is not a normal part of aging. It is a medical condition. It is treatable, and without treatment can result in severe disability to include suicide. Dementia is a memory loss that is associated with the inability to go about our activities of daily living. It can be caused by many things, such as alcohol, stroke, Alzheimer's disease, or many other medical conditions. Older African Americans are more likely to be diagnosed with depression, anxiety, and dementia. African Americans in general are more likely not to be offered treatment even when meeting the criteria for treatment. There may be multiple risk factors for mental health problems at any point in life. African Americans, as other communities of color, are more likely to experience socioeconomic disparities such as limited health, educational, social, and economic resources. These disparities increase risk for the development of mental health conditions and can lead to worse mental health outcomes. For example, African American children are more likely to be exposed to violence than other children. African Americans are only 13% of the U.S. population, yet comprise 40% of the U.S. homeless population and 38% of state prisons. 12% of African Americans live in deep poverty. And in 2018, 11.5% of African American adults in the United States had no form of health insurance. But how does this impact older African Americans? Older adults experience life stressors common to all people, but also stressors that are common in later life, like significant ongoing loss. Older adults may experience reduced mobility, chronic pain, frailty, and other health problems. We know that those with heart disease have higher rates of depression than those who are healthy. Older adults are more likely to experience events like bereavement or a drop in socioeconomic status that comes with retirement. All these stressors can result in isolation, loneliness, or psychological distress in older people, for which they may require long-term care. Last, older adults are also more vulnerable to elder abuse, which can lead not only to physical injuries, but also to serious and often long-lasting psychological consequences, including depression and anxiety. Although African Americans are just as likely to report serious psychological distress, they are less likely to get behavioral treatment. In 2018, less than 9% of African Americans received mental health services compared to 18.5% of white Americans. Many African Americans will not engage in clinical treatment because they see it only for mentally impaired or weak. They fear it conflicts with their religious, spiritual, or cultural beliefs, or they don't want to be stigmatized by others if they participate. These too are significant barriers for older African Americans and are compounded by factors such as bias and cultural incompetence among healthcare providers. The COVID-19 pandemic has magnified health disparities and hit older African American adults the hardest. They may live in generational households with those people who may be essential workers, and they may be caring for their children. Others may live in apartments, senior housing complexes, where they share laundry rooms, elevators, mailboxes, and common areas. Knowing that one is elderly and thus 2 to 5 times more likely to die of COVID-19 only increases fear and anxiety from getting the disease and dying from it. The stay-in-place orders have resulted in reduced opportunities for social interaction. The inability to go to church or the neighborhood senior center increases isolation and the risk for developing depression and suicide. The inability to go to the grocery store or to be familiar with technology or have the money to order meal delivery services limits access to proper nutrition, which is paramount to their survival. Although African Americans may show resilience to the profound loss, stress, and fear associated with COVID-19, I have seen an exacerbation in existing mental health disorders and the onset of new stress-related disorders for many people who did not have them before. Even though older African Americans qualify to receive the COVID-19 vaccine, many barriers still exist. Distrust of the medical system, reinforced by older African Americans' personal experience of racist practices through their lifetime, makes them mistrustful. Many are not tech savvy and do not have the needed technology. They may have mobility or hearing limitations that make long wait lines an additional burden. Further, vaccine sites may be outside of their area, and they may not have or know not how to access transportation. Fortunately, all is not lost for the older African American. We can be of service. Practice what I like to refer to as COVID-19 calls. Make regular phone calls and check on the older African American to see how they are doing. Learn and connect them to resources that provide services to seniors. Offer any assistance with their needs, such as transportation, grocery shopping, or doing laundry. Help them arrange to have medications delivered to their home. Without asking, drop off groceries or hard-to-find disinfectants, wipes, and masks. Be aware, not only have the rates of anxiety and depression increased during the pandemic, but also have substance use and intimate partner violence. Elders who have unexplained falls, worsened memory loss, and a sudden inability to manage their finances may be using substances or victims of elder abuse. If anyone you know is in immediate life-threatening danger, call 911. Otherwise, call the Elder Care Locator by telephone at 1-800-677-1116. That's 1-800-677-1116. If you have been the victim of abuse, exploitation, or neglect, please call your doctor, a friend, or a family member you trust, or call the Elder Care Locator helpline immediately. I would like to believe that the COVID-19 pandemic is the biggest global concern. The reality is that without fundamental change, the climate crisis will make pandemic-generated psychological, emotional, and behavioral problems seem less trivial. Research indicates that temperatures will increasingly expose every American to cascading disruptions to the ecological, social, and economic systems they rely on for food, water, jobs, income, health, safety, and other basic needs. Each year, 30 to 50% of the population will be impacted by more frequent, extreme, and prolonged rain, snow, windstorms, wildfires, floods, and other disasters. Our older adults remain the most vulnerable, yet because of the wealth of wisdom and sound resiliency, they are our greatest asset. Let us do what we can to protect them and to serve them, just as we would hope others will do when we become older ourselves, given that we have the luxury and great fortune of becoming older Americans. Thank you very much.